anxious to fight this virus and protect our healthcare workers. For every person that we take out of the chain of transmission, the more likely that our healthcare facilities can handle the capacity to respond. The more likely we beat back this virus sooner, not later. Staying home, avoiding gatherings or hanging out with people outside, avoiding gatherings or hanging out with people outside of your immediate household. Only going out if you're an essential worker, to take a trip to the grocery store, or to enjoy some fresh air. These steps may seem extreme. In a state like Montana, they may seem too cautious. After all, we're a state with a small population and at times sparse. But we must not forget that here in Montana, we face some unique challenges. Every action that we take now will help us overcome these challenges, or even better, make sure that we never have to confront them. We don't have to become like New York, Louisiana, or Idaho. And I'll do everything I possibly can to try to make sure that that doesn't happen on my watch. We can and we must keep efforts up to flattening the curve. Today, I will be extending the directive to stay at home for an additional 2 weeks through April 24th. First of all, staying at home will give our healthcare facilities more time to secure adequate hospital supplies so that when we do have our peak of cases, we're fully prepared. I'd also encourage you to wear a cloth mask or face covering consistent with CDC guidelines in public settings where other social distancing measures are difficult to maintain, such as grocery stores or pharmacies. Please use cloth face coverings and not surgical masks or N95 masks that are really needed by our healthcare workers and our first responders. It's also important to know that while cloth masks do help protect those around you, they should not be used as a replacement to social distancing or other protective measures such as washing your hands. I even looked around from my own supply at home. If Tristan from the Flathead Beacon was actually here, he'd see a buff that they provide on a regular basis for runners, or the Billings Trailhead has had cloth, or my own fishing one when I'm out with a buff. The fact of the matter is that we can take some of these steps. They're not overly intrusive, and we're watching out for one another. We're watching out for our neighbors along the way. You know, we do face the same challenge that every other state in the nation does with obtaining the amount of medical supplies needed to meet the demand. In a state like Montana, each hospital can't rely just on their medical supply sources, especially in the competitive and expansive market we see during COVID-19. We're working hard to survey hospitals and other providers all across our state to account for their need, whether rural or urban. We're working hard every day to find supply and make sure that it ends up in Montana and then to be distributed all throughout the state. 2/3 of hospitals in Montana surveyed did report that they have orders being canceled. And that's one of the reasons why, even at the state level, we're working each and every day. Montana's received 5 times more masks, N95 masks, from our friends to the east, North Dakota, than we have from our federal partners. While we've received an adequate supply of other items such as gowns and gloves to meet the current need, we'll certainly need more. We turn to the private market each and every day. We put orders in and are waiting on the arrival of 1 million N95 masks, among other supplies. Hope to receive some of those by the end of this week, but I'm not going to count on it till I actually see that delivery receipt here at the state. And we won't stop working to obtain every supply possible, whether through the private side or from the federal government. I don't want a day to go by where a nurse or an ER doctor doesn't have sufficient PPE to keep them, other patients, and their families safe. I don't want a day to go by where our first responders don't have the masks necessary to do their jobs. I know I join many Montanans in wanting to ensure that our healthcare workers and first responders have adequate PPE. And by staying at home, we can actually help make that a reality. Additionally, we're a state where there can be long distances to access care. It's easy to look at the map of COVID-19 cases and see that many central and eastern Montana counties don't yet have a positive case. Well, that seems like a bright spot, and it is. Also recognize an outbreak in a rural community could easily overrun a local healthcare facility. The distances between critical access hospitals in Montana are long, far. It's already difficult for our fellow rural Montanans to access care, and we ought to make sure that those challenges don't become more cumbersome. We stay at home for the Montanans in our rural communities and for our rural healthcare workers. We've already seen some of the challenges that we can face in a rural community in Toole County. The state was notified about a case at a long-term care center in Toole County on the evening of March 25th. Local public health, working with their partners within the medical community, worked quickly to identify other possible cases and close contacts to help prevent further spread of the virus. Infection prevention protocols for COVID-19 were put in place at both the assisted living facility and the local hospital. There's now been 20 cases associated with that event, including 17 Toole County cases and 3 from neighboring counties confirmed in Toole County. Cases include 7 residents of an assisted living facility, 5 employees of that facility, 7 of a neighboring medical facility, and 1 family contact. All the residents in the long-term care facility are under quarantine, including 3 individuals diagnosed with COVID-19 who are currently in isolation, and another case that is no longer in isolation. An incident command structure has been established in Glacier, Toole, and Pend Oreille counties. Bob Sandman, who retired from the DNRC and was the head of a Type 1 firefighting crew, he has experience working incident command, is acting as that local incident commander. This is a partnership between the state, Montana Hospital Association, and local governments. It's being led locally. Resources have been sent from across the region to assist. Everything from staffing support from Kalispell Regional Hospital to a number of Montana Air National Guard airmen serving as personnel. A deep clean of the hospital occurred yesterday. Deep clean of the assisted living facility is occurring today or tomorrow. And at the state level, we're in daily contact with the incident command team and those working on it, and really do want to give a props or a shout out to the good work that's being done on the ground with that unitary command team. It really is making a big difference. Finally, we stay at home, not just because of our rural areas, but we stay at home so that we can more quickly rebuild a thriving economy. It's not a choice between a healthy population and a healthy economy. The two go hand in hand. Managing this public health crisis now will prevent longer-term consequences that could upend our economy for a longer duration and with a worse outcome. I know and I recognize that this is an extremely challenging time for small businesses, medium businesses, workers, and family alike. We continue to strive to do everything that we can to help support those businesses and workers during this time. Along with the extension of the stay-at-home directive, we're also extending other directives on that same 2-week timeline, including the mandatory quarantine for certain travelers arriving into Montana from another state or country, the closure of all non-residential public schools in Montana, the restriction for on-premises food and beverage businesses, and the consumer protections to suspend evictions, foreclosures, and cancellation of utility services, including water, heating, and internet services, giving Montanans some critical financial support during this time. We continue to work to improve the process for filing for unemployment benefits. And from March 29th through April 5th, we issued over 24,000 payments to Montanans impacted by COVID-19. And today, we successfully sold bonds at a historically low interest rate in order to move forward with the planning and designing critical infrastructure projects across our state. In 2019, I signed legislation marking the first comprehensive statewide bond package in over a decade. Today, we made the first of 3 issuances of bonds at $33 million. We were able to do so in a volatile market created by COVID-19, in part because of our strong credit ratings and stable outlook predictions. By selling those bonds today, we're ensuring that when it is safe to do so, that we can immediately boost our economy by putting shovels in the dirt to both address infrastructure needs our communities have and create good paying jobs. And the selling of those bonds today allows Montanans to continue with that planning and design process. When the time comes, we don't have to wait on selling bonds. That's already done. Instead, we'll be ready right away to build on our economy by beginning the construction, creating an estimated 412 jobs, more than $20 million in wages. Also like to share 2 additional directives that we're issuing today. Local and county governments are integral to the response to COVID-19. They shouldn't be forced to levy additional taxes on Montanans to access emergency funding passed by Congress to respond to the needs of residents in this economic situation. So I'm issuing a directive waiving the current requirement that local and county governments implement a $2 million emergency levy in order to access new funding from the Federal CARES Act. Local and county governments won't need to use all available emergency levies before they can access state emergency or disaster funding. It's a simple fix that makes sense as we all work together to safeguard our economies during the COVID-19 emergency. Additionally, Montanans across our state have been relying on first responders. We're incredibly grateful for everything they've done to fight this virus on the front lines. Today, I am issuing a directive to protect our first responders by providing the clarification needed to allow all first responders to be notified before they come into contact with someone that has tested positive for COVID-19. For example, if a person who's being monitored and is in isolation at home requests an ambulance due to breathing issues, the ambulance could be dispatched with an exposure warning and emergency services personnel could be prepared with the appropriate PPE. There's already an established protocol to notify law enforcement, firefighters, emergency care providers, and corrections officers if they've assisted someone who's tested positive for COVID-19 after the fact. This measure will provide the information first responders need to safely do their job during this emergency and ensure that they can take appropriate precautions to protect themselves, their families, and to limit the spread of COVID-19. As we all work together to slow the spread of coronavirus, I'm daily reminded that we are in this together, and we'll get through it together. So thanks to all Montanans for their diligence and their sacrifice during this time. I'll now turn it over to questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. If the question has already been answered, if you press 5* again, you'll be taken out of that question queue. Questions?